Hi, and welcome to Verisk's Emerging Issues. My name is Greg Scabletti, an analyst at Verisk's Emerging Issues team. We research over 60 emerging risks facing P&C insurers, including today's topic, trends in pandemic disease. It's the end of October 2023. We're entering our third COVID winter and approaching year 4 of grappling with this virus. As much as we might wish that COVID was in the rearview mirror, it seems like it's here to stay, at least for now. And COVID isn't the only respiratory virus circulating in the population this time of year. It's also flu season, and we have RSV to worry about as well. Here to help us make sense of this is Narges Dorratoltaj, a research director at Verisk's Extreme Events Solutions. Narges, welcome. For
Thank you. Of
those who don't know you, can you give us a little bit of background on yourself and what you do at Verisk?
course. I'm Narges Dorratoltaj. I have been with Verisk for the past 7 years now, and I'm working on models for pandemic, any emerging risk and issues we may have, including extra mortality or morbidity that we see among people, mostly due to infectious diseases.
Great. So throughout the pandemic, I know you joined several emerging issues webinars to help bring some insights into the COVID-19 pandemic. What can you tell us about the state of the virus today as we enter into our third COVID winter?
Of course, I'm very glad that we were able to share some information and insights about the pandemic for the past 3 years. And yes, you're right. This is the third winter that we are experiencing with the COVID, the fourth year we are hearing about it. And I would say there are going to be many more years that and seasons that we are going to talk about COVID. I would like to start with giving a very brief update on the new variants that we are experiencing. As we know that COVID-19 disease and the virus that causes that SARS-CoV-2 keeps mutating, which means that we are going to see new variants. Currently, we are observing two major subvariants of Omicron. And these two subvariants are called Eris or EG5 and Pirola or BA286. These are the ones that we are seeing increase on the cases. If you want to talk about how different these subvariants are from either original Omicron or other subvariants of Omicron, they are similar to other subvariants of Omicron. They are highly transmissible, but we do not see evidence that tells us that they are necessarily causing more severe disease compared to previous variants. But we know that these things may change, and we keep an eye on them to get more information. Currently, the original Omicron strain is no longer circulating, and Delta and other previous variants are very rare, so we don't see many cases of them. But as I mentioned, that the SARS-CoV-2 virus is constantly mutating, so new variants could emerge at any time. Give you a brief overview of the two subvariants that I covered earlier, the Eris variant EG5. It was first identified in South Africa in November 2022, and we are seeing more than 100 countries that they're reporting seeing that subvariant of SARS-CoV-2. We do not have any evidence that Eris subvariant is causing more severe disease than other Omicron subvariants, and that's the same story about Pirola. Pirola, we are seeing more and more cases recently, and we are still, it's a subvariant of interest, so we gather information to learn more about that. The other update that I wanted to provide and bring our attention to is that updated vaccine. So we, on September 11, 2023, FDA approved the emergency use for the updated COVID-19 vaccine that are formulated to more closely target currently circulating variants and provide better protection about severe situations that people may experience, like hospitalization and death. We have two mRNA vaccines that are manufactured by Moderna and Pfizer, and they are available for people. They are monovalent, and they correspond to the Omicron variant. Also, on October 3rd, FDA approved the emergency use authorization for the Novavax COVID-19 vaccine, that people can take it, and like they have an option to take any of these vaccines. They are available, and we believe that we are going to see an updated version of the vaccine every season from now on. The other thing that I would like to briefly talk about is the increase in the cases that we observed for the past, I would say, couple months or so. I think we are going to stop calling them surge in the cases and start telling about the seasonality behavior of the COVID-19. Compared to other respiratory illnesses that we see seasonal behavior in them, COVID-19 has the highest number of cases, and we can also say the hospitalization. So that's going to be something that we see year over year. And we can say the reason behind that increase in the cases is that the waning immunity due to vaccination or infection, and rise in indoor activities because it's getting cold. So as I mentioned, this is not going to be the last time we are going to see increase in the cases, but we expect to see seasonal behavior from the virus in the coming years, at least for foreseeable future.
Okay, yeah, that's interesting. So obviously getting COVID is one thing and can be extremely serious, but then there's also long COVID. And I know the research around long COVID is evolving, but it does appear to be a serious concern for at least a portion of the people who have been infected. So what can you tell us about sort of the state of long COVID today?
Yeah, actually, long COVID is something that we heard about since the start of the pandemic from people who were experiencing long-term impact post acute infection. There are different types of symptoms that people may experience when they are recovering from the acute phase of the COVID-19. And it is not, if you want to talk about the definition of long COVID, we can say that it is a combination of conditions. It can include wide range of ongoing health problems, and they may last weeks, months, or years. People who are experiencing long COVID, they may experience general symptoms like tiredness and fatigue, or respiratory symptoms, or like difficulty of breathing. Some people may experience neurological symptoms like difficulty of thinking or concentrating, digestive symptoms like diarrhea, or even some people have unexplainable symptoms, that their symptoms are closer to the symptoms for people who are suffering from chronic fatigue syndrome. We can say that anyone who get infected by SARS-CoV-2 virus may develop long COVID and experience some symptoms of long COVID. But usually what we observe is that people who have more severe COVID illness, there is a higher chance that they experience long COVID over the next weeks, months, or years. But data shows us that we see higher incidence of long COVID among women compared to men, or older people compared to younger people. people who are not vaccinated against COVID-19, they may have higher chance of experiencing long COVID. Also, people who are are having comorbidities or immunocompromised, they experience symptoms that are resembling long COVID. And sometimes health inequalities for people who have less access to healthcare or their jobs require them to have certain conditions may make them more susceptible for developing long COVID. As of now, we do not have any specific treatment for long COVID, but CDC, NIH, and other organizations are working to understand more about the symptoms people experience, how they can control them. There are some clinical trials or observational studies that people who are experiencing these conditions participate in them. And we are hopeful that as time passes, we get more information and have a better solution to treat or control long COVID. In terms of what portion of population may experience long COVID, it really varies and it changed over time since the start of the pandemic. However, the data currently shows that around 10 to 14% of the population and around 10 to 20% of the people who reported that they experienced COVID, they may develop long COVID.
Wow. Okay. So not an insignificant percentage there. And you mentioned seasonality. This is also the season for flu and other respiratory illnesses like RSV. So what can you tell us about those today?
Sure. This year we are seeing the seasonal behavior of influenza and RSV both. Unlike the very first winter, the 2020-2021 winter, that because of the lockdowns, work from home, school closures, we were not seeing much activity of flu or way less severe activity from RSV. This year, we are seeing increase on the cases of influenza. I would like us to have some points of comparison. Flu season last year was different from what we were seeing pre-pandemic. We had the earlier peak, and the behavior of the scale of the seasonality was similar to 2019-2020 season. What we are seeing this year, we are seeing later peak, which is gonna be more similar to pre-pandemic years, and which tells us that we are going back to what we were experiencing during pre-pandemic in terms of seasonal influenza. And as we know that flu vaccine is available, this year the vaccine is available that has covered the two type A influenza, H1N1, H3N2, and 2 type B influenza. And this is aligned with the strains that we are seeing on the cases that we have. So we see H1N1 and H3N2 on the majority of cases of influenza that we have. In terms of RSV, is another respiratory infection that we see seasonal behavior. The pattern of the seasonality of RSV is very similar to influenza, and the behavior of the seasonal RSV for the pre-pandemic and during the pandemic has been very similar. During the very first year of the pandemic, we had minimum activity. And then last year we had earlier peak, but we expect that this year we are going back to pre-pandemic situation, which is we expect to have the peak during November, December, January, which is what we usually observe. For the in terms of RSV, if you wanna briefly talk about the symptoms are very similar to symptoms that people have when they have cold, but complications can include bronchitis and also pneumonia. And we know that very young people and very old people are at the higher risk of developing complications of RSV. The RSV vaccine is available and it has been approved this year, and it is shown that it has it is very effective in reducing the complications by about more than 80%. So for adults who are eligible to get vaccinated, it is recommended that they get vaccinated.
All right. Thank you so much, Nargis, for your insights today. And thank you all for listening. You can learn more about COVID-19 and other emerging pandemic risks on our website, core.verisk.com/EI. That's E as in emerging, I as in issues. While you're there, please sign up for our newsletter to stay on top of a variety of emerging risks facing the P&C insurance industry. Thank you.